Hey everyone, and welcome back to the channel. Today, we're diving deep into a clinical scenario that many future doctors and healthcare professionals will definitely encounter. Imagine this: a 14-year-old boy with a known history of cystic fibrosis comes into the clinic. He's not doing well. His cough, which is pretty chronic for him, has gotten much worse, and he's now coughing up thick, greenish sputum. Looking at his chart, you see he's been in and out of the hospital multiple times for lung infections. This time, you take a sputum sample and send it off to the lab. A few days later, the results are in. The culture dish is growing a gram-negative rod. But what's really striking is that the colonies are producing this distinct blue-green pigment. And when the lab tech opens the dish, there's this unmistakable, fruity, almost grape-like smell. So, the big question is, what's the organism? And what's its secret weapon for survival in this patient's lungs? If you guessed Pseudomonas Aeruginosa, you are absolutely correct. Those classic clues, the blue-green pigment called pyocyanin, and that fruity odor are dead giveaways for Pseudomonas. This bacterium is a notorious opportunistic pathogen, meaning it loves to strike when a person's defenses are down. And unfortunately, for patients with cystic fibrosis, their lungs provide the perfect environment. Cystic fibrosis, or CF, is a genetic disorder that affects the mucus-producing glands in the body. Instead of thin, slippery mucus, people with CF produce thick, sticky mucus that clogs up their airways. This makes it incredibly hard to clear out bacteria, creating a perfect breeding ground for infections. Pseudomonas is particularly well adapted to this environment. Now, let's talk about that key virulence factor. What does Pseudomonas use to protect itself, especially in the lungs of a CF patient? The answer is a polysaccharide slime layer, or biofilm, made of a substance called alginate. When Pseudomonas first sets up shop in the lungs, it's usually non-mucus, but over time, under the constant pressure from the host's immune system and antibiotics, it undergoes a dramatic transformation. It flips a genetic switch and starts overproducing this thick, goopy alginate. This is what we call the mucoid switch, and it's a major turning point in the infection. This isn't just a simple coating, it's a sophisticated fortress. The bacteria embed themselves within this slimy matrix, forming a complex community. This alginate biofilm is an absolute nightmare from a clinical standpoint. Why? First, it acts as a physical barrier. Think of it like a shield. When immune cells like macrophages and neutrophils, the body's first responders, arrive on the scene to gobble up the invaders, they can't get through the thick slime. The bacteria are effectively hidden, protected from phagocytosis. It's like trying to grab individual M&Ms out of a bowl of Jell-O. It's incredibly difficult. This allows the Pseudomonas population to grow unchecked, causing chronic inflammation and progressive lung damage. The constant battle between the immune system and the biofilm-protected bacteria leads to the release of destructive enzymes and inflammatory molecules that slowly destroy the delicate lung tissue. Second, this biofilm is also highly resistant to antibiotics. The slimy matrix can prevent antibiotics from even reaching the bacteria. It can bind to the drug molecules, neutralizing them before they can do any harm. Plus, the bacteria living deep within the biofilm are in a slow-growing, metabolically inactive state. Many antibiotics, like beta-lactams, work by targeting actively growing and dividing cells. So, these persistent cells within the biofilm are essentially sleeping through the antibiotic attack, only to wake up and repopulate the area once the treatment course is over. This is a huge reason why Pseudomonas infections in CF patients are so difficult to eradicate and often become chronic, lifelong problems. They can be managed, but rarely are they ever completely cured. This combination of immune evasion and antibiotic resistance makes the alginate biofilm the master key to Pseudomonas aeruginosa's long-term survival and devastating success in the lungs of patients with cystic fibrosis. So, to recap our case, the 14-year-old boy with CF has a chronic Pseudomonas infection. The organism's ability to produce that alginate biofilm is the primary reason it can evade his immune system, as phagocytic cells and persist despite repeated courses of antibiotics, leading to his worsening symptoms. Understanding this mechanism is crucial for developing new therapies that can perhaps disrupt this spiral, break down the fortress, and expose the bacteria to our immune system and our drugs. It's a huge area of ongoing research. I hope this deep dive was helpful and clarified the role of Pseudomonas and its powerful biofilm. If you found this video useful, please give it a thumbs up and hit that subscribe button for more content like this. Let me know in the comments if you have any questions or other topics you'd like to see covered. Thanks for watching, and I'll see you in the next one.